Now in this video we are going to see the patient who presents with short stature, how to evaluate this patient. Now what is short stature? Any individual who is below the third percentile in height for the mean height of a given age, sex and population group. So if it is below the third percentile, this patient is short statured or dwarf. Now if we proceed for the evaluation of dwarfism, we first rule out systemic illnesses. For example, patient with malabsorption, they remain short statured. Patients with congenital cyanotic heart diseases, they are small. Patients who've got different congenital chromosomal syndromes like congenital adrenal hyperplasia, the Down syndrome, the Noonan syndrome, etc., which have characteristic clinical appearances. And then we have got patients who've got asthma, which has been treated with systemic steroids. They may remain small, otherwise they attain normal heights. Patients who've got renal diseases like chronic renal failure, or if they have renal tubular defects, patients who've got heart failure, or patients who have got problem with the calcium and phosphate metabolism. If these are present, these can explain the patient's dwarfism or short stature. If these systemic conditions are not normal, look for the presence of body proportions between the limbs and the trunk. If they are disproportionate, look for the presence of short limb dwarfism, which is called achondroplasia. Some patient may have short trunk dwarfism, which is a variant of this thing, but it is uncommon. Most of the patients who are small, they have short limb dwarfism. And then if the body features are proportionate, look for the presence of mental abnormalities. If the patients are mentally normally developed or abnormally developed. If they are mentally abnormal, this may be cretinism or this may be gorgolism, that is mucopolysaccharidosis, or the patient either has congenital hypothyroidism or patient has gorgolism or mucopolysaccharidosis. And if the patient has normal mental development, this patient may be a familial dwarf, this patient may be a sporadic dwarf, or this patient may be a hypopituitary dwarf. So this is how we evaluate a patient who presents with short stature.